Hi there, I'm Dr. William Stiles talking to you on urologyanswers.com, talking today about bladder cancer. So bladder cancer is obviously cancer involving the urinary bladder. Here, if I draw the bladder, so the bladder sits here. In a male, the prostate is here. Obviously, a female would not have a prostate. And bladder is here. And draw. This is the wall of the bladder. And so orange here, this is muscle of the bladder wall. The bladder it's essentially a big muscle, and what it does is it passively stretches as it fills with urine, and then as the bladder is ready to empty, the bladder squeezes, generates pressure, and pushes urine out. So these muscle fibers are very important. Some of the most common symptoms you'll see with bladder cancer, the most common thing is painless, meaning there's no pain, hematuria, or blood in the urine. So if you have blood in the urine but there's no pain, that's one of the biggest tip-offs that there may be some type of bladder cancer present. Other symptoms include urinary frequency, urgency, and spasms of the bladder. These are the most common symptoms. Risk factors. Most common risk factor for bladder cancer is smoking. It's number one. Smoking is known to cause an increased risk of bladder cancer in patients. So this is the biggest risk factor. There's also risk factors for chemical exposure, and these are like aniline dyes and rubber products. Some of these have been known to increase the risk of bladder cancer, but the biggest one is smoking. Another risk factor is chronic irritation. You know, someone that has a chronic catheter in place, always irritating the bladder, that's a risk factor for bladder cancer. There are different types of bladder cancer. The most common type is what's called transitional cell carcinoma. That's because the bladder is lined with transitional cells, and these are the cells that are prone to cancer. So transitional cell carcinoma, squamous cell carcinoma, and these are cancers you see in patients that have chronic irritation, like I was talking about with the catheter. And then adenocarcinoma. These are the main types of bladder cancer. There are other types. You can have metastatic lesions from otherwhere in the body that lands in the bladder. But these are the main types of bladder cancer. What usually happens is, there's blood in the urine. That's alarming to most people. Patients then present usually to their primary doctor, will then usually refer them over to see a urologist. And the urologist will do a couple of things. Anytime there's blood in the urine that's persistent like that, the first thing the urologist will usually do is to do some type of imaging. CT scan is probably what needs to be done first. And what the CT scan does is it shows everything in the abdomen, from the kidneys, the tubes that drain the kidneys, the bladder, the prostate, all this. It gives us a great overall look at the inner workings of the genitourinary tract, because there's a lot of other things that can cause blood in the urine, like kidney stones, ureteral stones, bladder stones, all these other things that can cause blood. But obviously a tumor is in that differential as well. So CT scan imaging is often done. Most patients that have blood in the urine will undergo what's called cystoscopy. And cystoscopy is where a flexible telescope is placed in the urethra, and the bladder is filled with sterile fluid, and the entire lining of the bladder is inspected visually with that cystoscope. In the case of bladder cancer, you can have something that Looks like this. This would be representative of a very superficial bladder cancer. You know, it's picked up on cystoscopy, and then once it's found, the next step in management of bladder cancer, once it's found in the bladder, now you need to stage the cancer and you need to actually see how far this tumor has grown into the bladder. Is it just a superficial cancer, or is it just involving the lining of the bladder? Or is it growing deeper into the bladder? Because if it grows into this muscle, the management for bladder cancer is drastically different. Anytime a tumor gets access to the muscles, then it has access to the lymph nodes and the blood, the hematogenous spread of cancer. So it's ideal to have superficial cancers that are just involved in the lining of the bladder. Once it gets into the wall of the bladder, then it's more extensive, and usually, you know, more extensive surgery and things like that is needed. But a stage 1 bladder cancer is a superficial tumor. So it's a tumor that's growing, and it's essentially growing into the middle part of the bladder. It's not growing deep within the bladder wall or the muscle. Stage 2, that's when you have muscle involvement or muscle invasion. And again, you know that on what's called TURBT. This is an operative procedure that's done. It's transurethra, meaning through the urethra, resection or cutting away of this bladder tumor. So a telescope is put in with you asleep. The tumor is cut away, and you even remove deep into the wall of that bladder to make sure that there's no tumor in the wall of the bladder. And that's done, one, for curative effect, but also staging purposes to see, is this tumor in the muscle or is it just superficial? Now, stage 3 tumors, these are tumors that grow through the wall of the bladder. This superficial would be stage 1 here. Muscle invasion would be a tumor that grows like this and into this muscle. That would be stage 2. Stage 3 would be this, and it's growing outside of the bladder. So it's obviously has access to the muscle, but it's even further beyond the muscle. Now it's outside of that bladder. So stage 3, it's actually extended outside of the bladder. And then stage 4 is distant spread, or spread, you know, here, it's gone here, or it's in the prostate, it's in the sidewall, it's attaching itself to surrounding structures in the pelvis. And also distant, you know, distant metastases. So once a bladder cancer has access to the lymph nodes and the blood system, it can spread to the lungs, the brain, the colon, the liver. It can spread anywhere because it's spread through the blood system, essentially. So stage 4 is metastatic, or spread of cancer distant or into the prostate or rectum and things like that. So these are the different stages. The nice thing about bladder cancer is that most of these cancers are superficial. About 80% of these cancers are superficial. So most of them are caught early enough so that when they are superficial, all that need, I equate them in my office, I equate a superficial bladder cancer, I equate it to like a low-grade skin cancer that just involves removing the initial lesion or cutting the lesion away, cutting it away, and then looking at that area and making sure that there's nothing growing back. So most of these cancers are superficial. Now, the pathologist will get the specimen and he'll look at it and he'll decide whether it is low grade in appearance or high grade. And there's a big difference in these two. Low grade is a less virulent type of cancer. There's lower risk of recurrence. High grade cancers, these are more, they're still superficial, but they're just more likely to recur and more likely to be present and still grow despite local treatment and things like that. So you got low grade and high grade, and that's important to know what type of cancer you're dealing with. Are you dealing with a superficial cancer that's high grade, a superficial cancer that's low grade, or is there cancer in the muscle, things like that? So a lot to know here. Now, most of these cancers, when you undergo this TURBT, this procedure here, where the tumor is actually cut away from the wall of the bladder, oftentimes the urologist will put a chemotherapy, it's an installation of medicine that's placed in the bladder. The purpose of that is to kill any cells. When you cut into this tumor, the cells can spread and stay in that urinary tract. So the chemotherapy that just stays inside the bladder, there's no systemic effect of intravesical chemotherapy. The chemotherapy kills these cells that spread when the tumor is cut into. And that's been shown to improve outcomes with bladder cancer. So putting medicine in the bladder is very important. And that's called intravesical chemotherapy. And nowadays, it's almost always mitomycin C is what most urologists would use for intravesical chemotherapy at the time of initial bladder resection. Superficial tumors, high grade and low grade, most of these are treated, obviously, as we said, with just simply cutting the tumor away and then watching that area. So cystoscopic surveillance after initial resection is incredibly important. So patients will need recurrent cystoscopy, recurrent inspections of this bladder to make sure that this low-grade lesion hasn't returned and it hasn't changed in location. These tumors, these high-grade tumors, the risk of recurrence over your lifetime is somewhere around 90%. So high-grade tumors have a tendency to come back over the lifetime. The one thing you can do to help decrease your risk of recurrence right here, quit smoking. Remove those irritants of the bladder that we know cause cancer. So stopping smoking is incredibly important when you're dealing with bladder cancer as far as the management. Now, once a tumor has involved the muscle, now you get into radical type treatment. There's two options. One is to remove the bladder, and another option is intravenous or systemic chemotherapy plus radiation. So big difference. You can see superficial stage 1 cancers treated with bladder inspections, cutting away the original tumor. Once you get into muscle invasion, tumor into the wall or the muscle, now you're talking about radical treatment, removing the entire bladder and taking that cancer out and either reconstructing a new bladder with intestines or diverting the urine to the side in a urostomy. So removing the bladder is one of the options along with systemic chemotherapy and radiating this area. So that's for a stage 2 tumor. Bladder extension, same thing here. Same treatment options. Oftentimes patients will have pre-cystectomy is what it's called when the bladder is removed, but many patients will have pre-cystectomy chemotherapy given, and what that's done is to shrink the tumor, shrink the nodes before the surgery is done, and that's often done for management of bladder cancer. And then once the tumor is metastatic, now you're talking IV, chemo, as far as treatment and things like that. But there's a lot to bladder cancer. There's a lot that I left out, a lot of management issues that I left out. This is an overview, just something that just kind of shows you the basics of bladder cancer. There's a lot to it. And it's one of those situations that when patients are diagnosed with bladder cancer, it's important for them to visualize and know kind of what they're dealing with, what the staging is, what the risk factors are, what things look like so that they can prepare themselves better for treatment as far as knowing what to expect, knowing the recurrence rate, being sure they keep up on their surveillance and their bladder inspections after their initial treatment. So that's bladder cancer in a nutshell. I'm Dr. William Stiles, urologyanswers.com, answering your questions, showing you more about urological issues.